Today, we're covering what you should see and feel when you sit down in a dental exam chair, when the chair tilts back and work begins, and when the appointment is over. Stay with us because we're going to cover the one thing a great dentist says to you, because when he says it, you'll know you're in great hands. Dr. Devigus, during my appointment, the dentist suggested I do a filling on a tooth that is a little bit more yellow than the others. I asked, should I whiten my teeth first so that you can match the shade of my, how if my teeth were whiter? And she said, no, I'll make this tooth the whitest shade. Do you consider that approach beautiful or not?
Well, you are in the US, so we have to talk about differences in culture. It's interesting. I wrote a book about colors more than 20 years ago, and I always tell people, do you know that we have cultural differences? So the favorite color of Asian people is yellow. The favorite color of Europeans is red, orange. The favorite color of Americans is white.
Huh.
Well, and
Really?
this reflects also that a slightly yellow touch in teeth is considered nice in Asia, but not nice in the US. In the US, they want to toilet white. We call that in Europe. It's it's whiter than a teeth can be, because teeth are a very complex structure. So they have the enamel on the outside. That is the hard part that we need to protect to have the force also to bite and do things. And the inside of the tooth is weaker. It's called dentin, and this is also more yellow. So the outside makes the tooth look white or less white, depending also on the age. When the enamel gets thinner, the inside shines more through, and that's why a tooth gets yellow when you get older. So it's a complex situation, and it's always an interplay of light going through the tooth, coming back from the tooth, that makes a tooth look natural. And you can immediately see if somebody has fake teeth or not. So that's a fact. But it's really, I have patients say, look, doctor, I know that you don't like it, but I want it snow white, and then I say, okay. And there's something that you have to check in the mirror. And this is also something that everybody can do, is the white of your teeth corresponds with the white of your eyes.
Really?
Look at the African people. They have very white teeth, but also because the contrast of the very dark skin and the teeth, but their teeth are a little bit whiter than our teeth. And you look at the eyes of the African people, that's really white. The white of their eyes is white. It's bright white. And so if you look at the person, you look at the smile and you look at the eyes. The eyes is always the first. The eyes, you always look first in the eye of somebody. It's not the mouth. Mouth is second. First are the eyes.
That's great
And
counsel.
it's always that if you smile at me, I immediately catch if the teeth are too bright compared to your eyes. And this is
Wow.
like a good thing if you ask somebody. And our eyes are also getting a little bit more yellow when we age. So that's the combination. So the overall look does not change. So this is the fact. So if you then get and make your teeth too bright, too white, everybody says, yeah, okay, that's fake. And it's interesting that now there's also a shift a little bit in the beauty scene, that people say,
Today, we welcome Dr. Alessandro Devigus, who was editor-in-chief of the International Journal of Aesthetic Dentistry for 17 years. Dr. Devigus, we are happy you're taking time to talk to our Beauty Seat community.
so thank you very much for inviting me.
Well, I have to go back to get a filling, and I haven't had one in years. Can you tell me about a beautiful process for getting a filling as compared to one that's not?
Well, it depends. It depends where you get the filling, of the size of the filling, and again, what is the biggest problem of a patient? The biggest problem of a patient is fear of having pain. So whatever we do, whatever a doctor is doing, is we should avoid the patient feeling anything. So if I can get you a pain-free treatment, this is the most important thing, because you honestly, you cannot feel if I'm doing a perfect preparation, if my restoration is the best that can be done. But you feel that the treatment was relaxed. Not, the dentist was not stressed in any situation, or in any moment of the during the treatment, and the patient sits up and say, "Oh, I didn't feel anything." And if the patient sits up and say, "Can I rinse?" Yes. Be careful, because maybe your lip is still a little bit numb of the anesthesia with it, and they say, "Wow, it was great because I didn't feel anything." And this is the most important thing that you should try. Sometimes, if the patient comes with pain, you might even get more pain to the patient to remove the pain. So it's, but in a standard procedure, my goal is to tell the patient, look, we do a local, or we do an anesthesia to avoid any pain, and we do whatever I can. And if the patient should not feel, so use sharp instruments, use don't put too much pressure when you're working on a tooth. It's like, I always tell my colleagues, think about when you would sit in the chair, what you would love that the dentist would do on you, then do the same also on your patient. That's the thing. And number one is really smooth treatment, painless treatment. That's what the patient wants.
That makes sense. Yes, I don't want to be in pain while I'm getting my tooth fixed. Back in the day, I remember I had one dentist and maybe one orthodontist who had me bite down on it, almost felt like just a little plastic piece of paper. And I've never experienced that since. Is that part of a beautiful dental process, or should it be? Or is it not?
Yes, it's you as a dentist. At the end, when you finish with the procedure, you have to check if everything's okay. So if you restore a tooth and you say, "Wow, I did a beautiful anatomy. This looks like an artwork," but then you have to check if it fits to the rest of your teeth. So what we do with this with articulating paper, it's called articulation, is the process of biting the teeth together, and then you check if there's any contact that disturbs. So first of all, you always ask the patient, if you just open and close, do you feel anything? And if they say, well, it feels a little bit strange, then you check, then you check and see, there's like a contact that is too strong, and then you can remove that. And that's the thing. It's the final, let's say it's the final control. You finished your artwork, and then you do the final check. And that's important, because otherwise, if you don't do that and the patient goes home and it's too high and the patient bites, he can fracture the restoration, or worse, he can even fracture the tooth, or it creates pain, because if the dentition, if the system is not working properly anymore, you get symptoms, you get problems, so this final check is like the final check, when you bring your car to the service, that they say, okay, check, 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 everything's okay, then you can go home. And the same is, we do a final check of our work before we let the patient go.
That makes sense. So if I have two teeth that are touching on this side and not on this side, you catch that with the articulation paper.
Yeah.
Gotcha. Perfect. I replaced my silver fillings, I think they were, many years ago. And I'm not even sure I know what the white filling that replaced them was made out of. What type of filling materials are like the most beautiful and which ones are not?
Oh, this is an interesting discussion because the material that replaced what we called amalgam. Amalgam is the name of these silver fillings. Um, is composite. Composite means a composition of materials. It's let's say in an ordinary word we would say plastic, but it's a little bit more complex than just plastic or of a plastic bottle. It's a high end uh, uh, composite material that basically is kind of a plastic that is the most used material these days because we have a lot of patients with small fillings, and these are uh, materials that you can put also in a small cavity, and then with light you cure it, you harden it, so it's something that is soft. You place it on the tooth surface or inside the hole that you want to fill, and then with the light you cure it, you harden it. And the light is interesting. A lot of people are saying, is this UV light? No, it's just blue light. So these lamps that dentists are using to harden the materials is blue light. And you know why? Because blue light is the light with the highest energy in the visible spectrum. Just to tell, yes, blue, and you see the blue light. But it's the light with the highest energy, and this makes sense because what you're doing with the light is you have particles, chemical parts inside this material, and then there are some photosensitive parts that are activated with the light and then start a chemical reaction. So that's a trick, and these light curing materials, it's basically the same that also the nail artists are using. When you put your hands in this light box to harden the material, that's the same concept. But the material that you use for teeth is, let's say, of a higher quality because it also has to be biocompatible. It has to fulfill other criteria because it's inside the mouth. It's not just something that you put on your nails, and it's something that should also last longer. And then we have the second category of material that is ceramics. Ceramics that we use for veneers, crowns, and this is considered a longer lasting material. It's more expensive. It's sometimes a little bit more complex to work with. And it's interesting, there's a huge debate. So some people say, I only work with ceramic because this is the best material. And others say, no, I only work with composite because I don't want to be invasive. I want to save tooth structure. And if you work with composite, you add on material. So often when you use ceramics, you have to cut down the teeth a little bit. Not always, but most of the times you have to cut more tooth structure to put this ceramic tiles. It's like putting tiles in your bathroom. It's a little bit more complex thing. But at the end, we have two materials. It's composite materials and ceramics that are the two aesthetic materials. And coming back to aesthetics, it's always interesting. Then I ask dentists, okay, they're specialists of aesthetic dentistry, but do you know a specialist of anesthetic dentistry? So who wants to do ugly work? Nobody wants. So basically, we are all aesthetic dentists because we want to improve the appearance of our patients. And we call these materials tooth-colored materials. So we want that these materials match the color and also the property of our teeth. So basically, ceramic is a little bit closer to the enamel, to the outside of our teeth, the harder part. And composite is a little bit closer to the inside of the tooth that is a little bit softer. So it's the thing would be like a combination of the two materials, or depending on the situation or what you are replacing, it's sometimes also the combination of the two materials that you need to use. But again, it's important that the dentist knows what materials he's using, what the properties of the materials are. And I often see that dentists are not aware. They don't know what the properties of the materials are. So maybe they have heard about and they're doing this, and maybe sometimes they're disappointed. Why is it not looking the way I expected? You need to learn how your materials perform when you put them in your patient mouth, when you put them on top of your the patient teeth. So this is something that is not so easy, and you need to understand that, and that's why it's not an easy job to be a really aesthetic dentist.
That makes sense. And I feel sad because I didn't have a lot of time with the dentist. I said, would that be composite? And I honestly didn't even understand the question I was asking. And she said, yes. But at walking away last night, I felt like I feel like I want more data. I shouldn't just be making an appointment with this dentist because I spent really probably 20 minutes with her.
I always try to explain things very, let's say, visual, very easily. So for the selection composite or ceramic, if sometimes a patient asks, yeah, last time you did the ceramic restorations, why are you doing composite today? You told me that composite is a little bit, it's also in the pricing. Composite is cheaper than ceramic, but it's also something that was established over the years, that we were positioning ceramic as the high-end material. It's like the Louis Vuitton, Gucci, Hermes, whatever, and the composite was like more the lower brand, but that's not the fact. So basically, both materials have evolved. Composite are now in the, I don't know what generation. Ceramics have evolved as well. So the two materials, you need to find the right indication for the right material. And I tell people, small volumes, if you have to do a small restoration, composite is, in most of the cases, the way to go. If the volume is large, if we have to replace a huge part of the tooth, ceramic might be the better option. It's because a composite is also, when you light cure a composite, it's shrinking, and the ceramic is not shrinking. So basically, small things with composite, larger things with ceramic. So this is something that also my patients understand, that I say, look, these are both have their advantages, downsides, but at the end, it's the indication that gives me the idea what material is the best, because there is no best material. It's the best material for a given situation.
I love that. I love that you're taking time to explain the difference between even just materials to your patient. That I think is needed in this community. Dr. Devigus, we are happy you're taking time to talk to our BeautyC community.
So thank you very much for inviting me, and the pleasure was on my side.
Beauty Seekers, thank you for being here and learning with us. Next, Dr. Devigus covers a bit more of the technology side of dentistry and how use of that tech can be a signal to you that you are in a great dentist's hands. And don't go anywhere, because soon he will share the one sign that most patients don't even think to watch for to know that they are also in good dentist hands. It may change how you choose a dentist forever.
What we call less invasive procedure would do the job as well. It's often because of laziness of the dentist that he's going for a more invasive procedure